Welcome to the Deep Dive. Today we're getting into a topic that's, well, surprisingly central to your overall health, sexual well-being.
Hmm.
We're going to be exploring the insights from Sensational Sex in 7 Easy Steps by Dr. Ridwan Shabsigh. He's a leading urologist.
Yeah, and our mission here really is to pull out the most important stuff from Dr. Shabsigh's work, give you a kind of shortcut to understanding this connection.
Right, without having to read the whole book. Think of it as getting the key insights for a healthier you, maybe from an angle you haven't really thought about before.
Exactly. And it's important to note, this isn't just, one doctor's opinion. Dr. Shabsigh founded the New York Center for Human Sexuality at Columbia University,
Wow.
and he collaborated with a whole range of medical pros. He acknowledges Bruce Scally, a writer, Los de la Haba, his agent, colleagues like Dr. Mitchell Benson, Dr. Carl Olson.
A lot of experts involved.
Oh yeah, Dr. Harry Fish, Aaron Katz, Hilda Hutcherson, David Samadi, James McKiernan, plus others for artwork, calligraphy, editing, development. It's a comprehensive effort.
So a solid foundation. What's really fascinating, you mentioned Dr. Olson.
Yes, Dr. Shabsigh's supervisor. Apparently, he had this very direct way with new patients. He'd just say, "You will have sex."
Slight chuckle. Direct is right.
It really underscores how fundamental they viewed sexual health. Not just some optional extra, It's core to well-being.
Okay, so let's get into that core idea. The book really hammers home that sexual dysfunction, especially ED, erectile dysfunction, it's often not just its own problem.
Right. It could be a big red flag.
A red flag for what? Underlying general health issues?
Exactly. And the flip side is true too. Improve your overall health, and your sexual function can definitely benefit.
That feels like a big shift in thinking.
It really is.
Yeah.
The book points out the consensus now is that, 80 to 90% of ED cases, they have physical or medical roots.
80 to 90%, that's huge.
Yeah, it's almost a complete reversal from, say, a generation ago. Back then, it was all thought to be psychological. But Dr. Shabsigh is clear. Whether it starts physically or psychologically, it is a health issue. It needs attention.
Okay, so how does this connection work? Mechanically, I mean.
Well, think about what sex requires. Your cardiovascular system needs to be working well. Blood flow is key.
Okay.
Your nervous system has to transmit signals correctly. Your brain plays a huge role, obviously. And hormones, particularly testosterone in men,
It's all connected.
deeply connected. So if there's a problem in any of those systems, heart, nerves, hormones, and cry, it can absolutely show up as a sexual health issue.
And the book suggests this can be like an early warning.
Precisely. Especially for cardiovascular disease. Dr. Shabsigh uses this phrase, rusting of your arteries.
Vivid.
It paints a picture, doesn't it? Things
Yeah.
like abnormal blood pressure, high cholesterol, difficulty with erections. These can be the first hints of heart trouble brewing.
So the takeaway for listeners is don't ignore it.
Definitely don't ignore it. Any concerns about sexual function? That warrants a doctor's visit to find the root cause.
And doctors should be looking beyond just the ED itself.
Absolutely. If a patient comes in with ED, the doctor should be thinking, okay, what else could be going on here? Look at the bigger health picture.
This ties into something called metabolic syndrome or syndrome X, right? The book mentions that.
Yes, Syndrome X. Think of it as, well, maybe your body's just struggling to keep things balanced across multiple areas. It's like the systems aren't coordinating properly.
It's pretty common.
Surprisingly common. The Mayo Clinic estimated maybe 1 in 4 adults. Could be 40% of people over 40 based on national surveys.
Wow. And what are the signs? What makes up metabolic syndrome?
There are 5 key things the book lists. One is abdominal obesity, basically. Too much belly fat. A waistline over 40 inches for men is the marker.
Okay.
2 is dyslipidemia, that's unhealthy cholesterol levels. High triglycerides, high LDL, the bad stuff. Low HDL, the good stuff.
Got it.
3 is hypertension, or high blood pressure. 4 is hyperinsulinemia, too much insulin. And 5 is hyperglycemia, high blood sugar.
And there's a link to testosterone too.
Yes, a documented link. Lower testosterone levels are often seen in men with metabolic syndrome. It just shows how interconnected these health factors really are.
The book then gets a bit more technical, talking about endothelial dysfunction. Can you break that down for us?
Sure, the endothelium is the inner lining of your arteries. Dysfunction means that lining is breaking down or not working properly.
What causes that breakdown?
Things like oxidation damage from unstable molecules, glycation where sugar molecules bind to proteins, fats building up, plaque formation. It basically damages the artery walls from the inside.
And why is this particularly relevant to sexual health, specifically ED?
Well, the penis is a highly vascular organ. lots of blood vessels. And the key point is the arteries in the penis are tiny. We're talking 1 to 2 millimeters wide.
Much smaller than, say, in the heart or legs.
Exactly. And the tissue there have a high concentration of that endothelial lining and the smooth muscle that controls blood flow. So it's super sensitive to any damage or blockage.
So problems might show up there first.
That's the crucial insight. Because those vessels are so small and sensitive vascular problems, this endothelial dysfunction, atherosclerosis might become noticeable in the penis before you feel symptoms anywhere else.
Like the canary in the coal mine.
Precisely.
Yeah.
ED can be a really early marker for underlying cardiovascular disease that hasn't, caused chest pain or anything else yet.
This leads into a discussion about how men maybe stereotypically approach their health.
Yeah, the book touches on that. The tendency for men to prioritize work, providing for the family. Often their own health gets pushed way down the list, put on the back burner.
Is there a sort of feeling of invincibility involved sometimes?
I think so. Maybe a subconscious belief that serious stuff like strokes or heart attacks, it happens to other people, older people maybe, not me.
But the statistics tell a different story.
A very different story. The book lays out some pretty sobering facts. Men die younger than women for all 15 leading causes of death in the U.S.
All 50.
All 15. And the death rates for accidents, suicide, cirrhosis of the liver, homicide, they're more than double for men.
Wow.
Men also have higher rates of high blood pressure, about 20% more. Higher rates of cancer, 30% more. Even male babies have a higher mortality rate in their first year. It really challenges that idea of invincibility.
So, given that reality, what's being done? Or what can be done to improve men's healthcare engagement?
Well, the medical community is trying different things. More privacy, maybe more anonymity in clinics, extending clinic hours, workplace health facility.
Making it easier to access care?
Trying to, yeah. Broader screening tests, advertising targeted specifically at men, but awareness isn't quite enough, is it?
No, you have to actually go.
You have to go. And you need to ask the right questions, have the right conversations. The book points out that beyond, cholesterol tests and basic cancer screenings, there isn't always a standard approach.
Things get missed.
Often, yeah. Occupational stress, psychological well-being, relationship factors, even just basic health education.
Yeah.
These aren't consistently addressed in typical men's checkups.
And that's where the book aims to help. To empower men to get more out of those visits.
Exactly, to know what to ask, what to bring up.
What are some of the key questions or areas the book suggests focusing on?
Well, first is being honest about sexual function. Any changes in desire, erections, ejaculation, don't shy away from it.
Okay.
Medications, be thorough. Prescription, over-the-counter, supplements. Tell your doctor everything.
Lifestyle factors too, presumably.
Absolutely critical. Smoking, alcohol, any drug use, exercise habits, or lack thereof.
And family history.
Very important. What health issues did your parents have? What did they pass away from? It gives vital clues about your own risks. And fundamentally, have you had a general physical in the last year? That's a baseline.
The book introduces this idea of a self-test, kind of like a cholesterol test for sexual function. Tell us about that.
Yeah, it's an interesting concept. It's a questionnaire that gives you a score indicating the status of your sexual function. But it does more than that.
How so?
It also helps you identify risk factors across different areas: lifestyle, relationships, medical history, even your psychological state. It connects the dots.
So it's not just a score, it's a call to action. It highlights areas needing attention.
Precisely. It points you towards where you might need to focus.
Does it cover specific health areas?
It covers 10 domains. We
What?
don't need to list them all, but examples are overall health and sexual erectile function.
And the scores give recommendations.
Right. So for sexual function, maybe a score of 6 means keep doing what you're doing, see you next year. But a score of 4 or less, the recommendation is schedule a checkup soon.
Makes sense. What about relationships?
There's a primary relationship domain. A high score suggests things are good. A lower score might trigger advice to work on the relationship, maybe even suggest counseling.
Okay, and how does the overall scoring work? Max score, interpretation.
The total score goes from 1 up to 40. A score of 36/40 is considered excellent. Maintain your healthy habits. 32/35 is very good, but room for improvement following the book steps.
And lower scores.
Below 20 is flagged as poor, but the message is optimistic. It emphasizes that significant improvement is definitely possible, often within 6 to 12 months with commitment and medical help.
That's encouraging. And the book stresses that most of these factors are controllable, right?
Hugely important point. Apart from age itself, almost everything else in the self-test is something you can influence.
So even if you're getting older, taking action can offset some effects.
Exactly. Improving your weight, exercising more. These things boost your score and improve how you feel about your health. Tackling multiple areas has a cumulative effect on health, sex life, happiness.
But getting started can be tough. The book mentions barriers, things that stop men from seeking help. What are some common ones?
Oh, several big ones. Embarrassment is huge, just feeling awkward talking about it.
Understand.
Denial, pretending there isn't a problem. Trivialization, thinking it's not a real health issue compared to others.
Like it's just sex.
Kinda, yeah. Then there's resignation, what the book calls fait accompli, just accepting it as inevitable, especially with age.
Fear must play a role too.
Definitely. Fear of what the diagnosis might be, or fear of having to make difficult lifestyle changes like quitting smoking or losing weight.
And relationship factors.
Yes, sometimes blaming the partner, or maybe existing relationship problems get in the way. The book cites a survey where almost 22% of men blamed their partner for their ED.
Wow. It's important then to know this is common. The book gives stats on ED prevalence.
It does. It mentions the Massachusetts male aging study from '94 finding 52% of men over 40 had some degree of dysfunction.
Over half.
Yeah. Then the National Health and Social Life Survey in '99 found 16% of men under 40 reported ED.
So it affects younger men too.
Absolutely.
Yeah.
And a 2003 study found 33% of men aged 50-93 had experienced it recently. An estimate from 2005 put the number in the U.S. around 30 million men.
So the message is clear.
You're not alone. Whatever your age, it's a common issue.
But common doesn't mean harmless. What are the consequences of not addressing it?
The book is pretty blunt here. Ignoring sexual health issues can lead to serious problems later. Heart attack, stroke, depression.
It's a sign something deeper might be wrong.
Exactly. Avoidance doesn't cure anything. The problem, and likely your overall health, will probably just get worse. Taking action now, though, can prevent future crises, health, relationship, family, career, overall unhappiness.
So step one is often that doctor conversation. What's the advice there?
Make sexual health part of the regular checkup. Don't wait for a problem. Your doctor should be comfortable discussing it.
And ask specific questions.
Ideally, yes. About desire, performance, satisfaction, anxiety, relationship context, lifestyle. The whole picture.
What if your primary doctor isn't that knowledgeable in this area?
Then they should provide a referral to a specialist in sexual medicine. That expertise is available.
But the first move is often the hardest, just bringing it up. What motivates men to finally do it?
The book mentions a survey. Personal motivation was the biggest driver, about 58%. Just deciding enough is enough.
Makes sense. What else?
Encouragement from a spouse or partner was huge, 40%. The media played a role for 28%.
Interesting.
Yeah. Friends, family, ads, pharmacists, even online info. They all contribute for some men. But the key is just getting that ball rolling however it starts.
Okay, so identifying the issue is step one. The book then moves to solutions. Step two is called lifestyling. What's that about?
The lifestyling is all about how your everyday choices, diet, exercise, stress management, impact both your general health and your sexual health. They're intertwined.
A book uses an example, right? Harold B.
Yeah, Harold B., a 52-year-old diplomat.
Yeah.
Looked healthy, trim suit, good job, but experiencing ED.
And the cause was lifestyle.
Turned out it was. Rich diplomatic dinners, frequent alcohol, not much exercise due to constant travel, erratic sleep. It all added up.
So what did they tell him to do?
Specific things. Take more actual vacations, schedule exercise even when traveling, watch the food and alcohol intake carefully, give himself time to digest before sleep, use relaxation techniques.
And did it work?
Within 6 months, big improvement in his sexual function. It's a great illustration of the core principle.
Okay, so let's dig into some of those key lifestyle factors. Exercise comes up a lot.
Yes, aerobic exercise is strongly recommended. Good for the heart, good for blood flow everywhere, including the brain. Can help reduce cravings, build mental strength.
What if someone is quite overweight? How should they start?
Start slow.
Yeah.
Gradually increase intensity. Very important. And the book suggests getting your support system involved.
How so? Like AA?
Similar principle. Tell family, friends your goals. Ask for encouragement. Ask them maybe not to tempt you with unhealthy stuff.
Accountability.
Exactly. And find healthy distractions for cravings. Reward yourself for progress. And crucially, persistence. If you slip up, just get right back on track.
Okay, another big one. Smoking.
Non-negotiable, really. If you smoke, Quitting is paramount for both overall and sexual health. The book lists the grim stats on deaths and costs.
Are there tools to help?
Lots. Over-the-counter nicotine gum, patches, prescription options too, bupropion, nicotine inhalers, sprays, varenicline.
Do the prescription ones work better?
They can double your chances of quitting, apparently.
Yeah.
And the book notes they can be used safely even if you have cardiovascular disease, which is important.
Quitting is hard, though. Relapse triggers.
Oh, yeah. Alcohol, being around other smokers, sometimes weight gain after quitting, stress. The key is having strategies ready before those triggers hit.
Is it ever too late to quit?
Never. Benefits start almost immediately at any age, and every quit attempt makes the next one more likely to succeed. Just don't substitute smoking with another bad habit like drinking more. If you relapse, jump back on the horse immediately.
Right. Next up, weight management.
Another huge factor. The book tackles the myth that weight gain is just normal aging, just like ED isn't normal aging.
How do you know if you need to lose weight?
Use the BMI chart, body mass index. It gives you good indication. And the book warns against ignoring small weight gains. Uses an analogy.
Stealing the egg, stealing the camel.
That's the one. Little bits add up to a big problem over time. It cites the huge number of overweight Americans and the clear links to health problems, including sexual dysfunction, plus the massive costs.
So what's the book's approach to losing weight? Starvation diets?
No, definitely not. It emphasizes balance, portion control, specific fruits and veggies, avoiding starvation mode. Healthy snacks are actually important to keep energy up and avoid feeling deprived.
What's the fundamental principle then?
Simple physics, really. Calories in versus calories out. To lose weight, you have to burn more calories than you eat.
Does it compare different diet types?
Briefly, it looks at calorie counts for typical American diets versus, say, USDA guidelines or lower-fat diets. It does caution that some restrictive diets might lack nutrients, so balance is key. Maybe check with a doctor for big changes.
And there's a tool to help track this.
Yes, the SEED. Shabsigh Eating and Exercise Diary. It's for tracking your intake and activity to understand your patterns and plan reductions.
What are some of the truths about weight loss the book emphasizes?
One is acknowledging that maybe friends and family haven't always been totally honest about your weight, perhaps trying to be kind.
Tough love needed sometimes.
Maybe just factual awareness. Then there's the basic equation. Eat more than you burn, you gain. Eat less, you lose. Eat the same, you maintain. Simple.
Does exercise or diet matter more for weight loss?
Diet generally has a more dramatic impact on the number on the scale. Exercise is crucial for health and maintaining loss, but you can't easily out-exercise a really bad diet. The book gives an example of a neighbor doing just that.
Okay. Any specific food types recommended?
Focus on complex carbs and protein. They help keep blood sugar stable, keep you feeling full longer, which helps manage cravings.
So what's the step-by-step course of action for weight loss?
First, commit. Understand the myths and facts. Second, check your BMI. Third, use the SEED diary for a week to figure out your current mode, gaining, losing, maintaining.
Get a baseline.
Exactly. Fourth, set a realistic goal. Maybe 10% of body weight over 6 months. Fifth, plan your changes. Aim to cut 300, 500 calories a day for about a pound a week loss, or maybe 500, 1,000 for up to 2 pounds a week initially.
Any practical tips?
Chew slowly, use smaller plates for portion control, have healthy snacks ready, like raw veggies, nuts, fruit. Calorie counting gadgets can help with motivation, even if not perfectly accurate, and it refers to an exercise calorie expenditure table.
What does the SEED diary actually track?
Things like height, waist circumference, pant size, BMI, your current weight mode, and then a detailed 24-hour log of everything you eat to calculate daily calories.
And you should check BMI regularly.
Monthly checks are recommended, and again, persistence. Don't let a bad day derail the whole effort.
Can you give an example from that calorie expenditure table, just to give an idea?
Sure. It shows estimates like sleep and burns about 55 calories an hour, just sitting, maybe 85. Brisk walking, around 200. Jogging could be 570 or more per hour. It helps put activity into perspective.
Okay. Beyond weight loss specifics, any general diet recommendations for overall health?
Yeah, quite a few. Drink plenty of water, eat lots of fruits and vegetables, wash them well, focus on leafy greens, variety of colors.
Carbs.
Go for complex carbs, whole grains, oat bran, multigrain bread, fruit. Limit or cut out white rice, white flour, sugar, potatoes, maybe pasta only occasionally. Whole wheat is better.
Protein sources.
Fish, baked or broiled, not fried. Skinless poultry, lean meats, beans, lentils, nuts, seeds, eggs in moderation.
Dairy and fat.
Low-fat dairy. Healthy fats like olive oil, canola oil, but use moderately. Flavor food with herbs, spices, lemon, vinegar instead of salt and fat.
And things to avoid.
Processed foods, sugary drinks, too much saturated or trans fat. It also gives tips for making healthier choices with different ethnic cuisines: Chinese, Greek, Indian, Mexican, Italian.
What about supplements? There are so many out there.
The book is cautious, acknowledges potential benefits, but also risks taking too much. Interactions with medications like St. John's wort interfering with things.
So what's the guideline?
Research first, using reliable sources like PubMed or the PDR for non-prescription drugs. Choose brands with actual studies behind them. From reputable sources, be careful buying online. And always talk to your doctor before starting any supplement.
So maybe some basic ones are okay after a doctor consult?
Possibly. A healthy lifestyle might include a few proven supplements, but only after that discussion with your physician.
Okay, step 2 also includes sexual fitness. What does that mean here?
It's really about the exercise component again, linking it directly to sexual health. Same caveats apply. Check with your doctor first. Stop if you feel pain.
Don't get injured, try and get fit.
Exactly. Unsafe exercise leads to setbacks. Warm-ups and cool-downs are important, especially if you're inactive or overweight. Start slow, maybe half the recommended program a few times a week initially.
Does it mention target heart rates?
Yes, aims for 50–75% of your maximum heart rate, which is roughly 220 minus your age.
Does it give a sample routine?
It does. Like maybe Tuesday, Thursday, Saturday, stretches, then 3 sets of 10 push-ups, 20 crunches, 10 deep knee bends, 10 bicep curls with light weights, 10 tricep curls. Just an example to get started.
What about exercising when traveling?
Use the hotel gym if there is one. Pack resistance bands or jump rope. It even suggests simple exercises you can do on a plane. Ankle circles, leg lifts, shoulder rolls, neck rolls, torso twists. Keep moving.
And the final part of step 2 is time management. How does that fit in?
The idea is that tracking your time helps you see where it actually goes. Then managing it lets you consciously allocate time for things that matter, including exercise, healthy eating, relaxation, relationships.
It's not about finding time, but making time.
Exactly. The book pushes back on "I don't have time." It says you make time. It suggests asking simple questions about your activities. Did I plan this? Was it necessary? Was it enjoyable? What did I get out of it? Should I do it more, less, or replace it?
So being intentional about how you spend your hours.
Right. Evaluating your time use helps you prioritize health and relationships, which ultimately feeds back into sexual well-being and overall life satisfaction.
Okay, so as we wrap up this deep dive, looking at Dr. Shabsigh's work on sexual health and overall well-being, what's the big takeaway?
I think the absolute core message is these two things, sexual health and general health, are just fundamentally intertwined. You can't really separate them.
And improving one often helps the other.
Almost always. It's about seeing the connections, adopting a more holistic view of your own well-being, not just treating isolated symptoms.
And the key actions the book recommends boil down to:
Talk to your doctor regularly, proactively. Make conscious, sustainable lifestyle changes, diet, exercise, stress, and really pay attention to your body's signals. Use that sex thermometer idea as an indicator of your overall health status.
listen to your body. That's really powerful. Any final thought for our listeners mulling over this connection?
Just maybe consider this. What if really committing to your overall health doesn't just improve things in the bedroom, but it also unlocks more energy, boosts your mood, enhances your overall quality of life in ways you might not even expect? It's worth exploring, maybe digging into the book more, and definitely having those conversations with your doctor.